So my name is Diamond Fernandez, and I'm your founder and director of the HeartFit Clinic. At the HeartFit Clinic, we see people who have heart disease and want to reverse that disease process. And we see a lot of people who want to prevent a heart attack or stroke, because the best heart attack is the one that never happens. Yeah, many people ask us where our passion comes from, and it really comes from when my father, he had his first heart attack at 38 years old. At 42 years old, he had bypass surgery. Obviously, he's living well, focusing on what we promote at the HeartFit Clinic. And that's really what it's about, is that you don't have to go down that path of having heart disease being such an ailment to you. We're very passionate about why do you have that problem, and we go deeper than what you would get, unfortunately, in our healthcare system. So many people ask me, why do the majority of heart attacks and strokes occur with blockages that are less than 50%? And when we look at an artery, it's a muscle, not a pipe. Let me explain. So many times people think as their arteries, like the kitchen sink, when we have cholesterol just accumulate to the side of these pipes, and they just accumulate to a point where as soon as it gets to 90%, it blocks up. Well, it's furthest from the truth. The majority of heart attacks and strokes occur with blockages that are less than 50%. And when we look at it from that perspective, your arteries are a muscle, not a pipe. So when we see a small blockage like this, what's actually happening is that a plaque starts to form inside the artery, just like a pimple on your skin. And so what happens is that you could go see your family doctor or even a cardiologist, and they can do the most invasive tests possible to see where you are, but they're not able to see what's happening to see where your risk is of a plaque exploding, or that pimple. Everyone's had that pimple on their face where it grows and it gets a little bit bigger, and the skin holding that pimple in place can't hold that contents of that pimple, so it pops. And everyone's had that pop before where it pushes and bleeds. Well, if that happens inside the artery, that's a heart attack. And so here you can see the skin has broken off, and now it's starting to bleed. Now, most arteries, they can try to heal themselves as best they can there, but what can happen majority of times is it actually goes from a small blockage, let's call this 30%, 40%, all the way to 100% blockage very quickly, and that is a heart attack or stroke. So some common questions I get. I went to the hospital. The common situation is someone says, okay, I went to the hospital, I went to the ER, they thought I was having a heart attack, and they did a blood test. In that blood test, they're looking specifically for troponins and CK enzymes. And they're actually looking to see if you are right here. If you're actually having a heart attack or stroke, that actually shows to the heart muscle itself. So the heart muscle shows itself there and it says, okay, well, I have these two enzymes, troponins and CK enzymes, that are in the heart itself, and we can actually tell if you're having a heart attack or stroke at that time. If you're having chest pain and you're in the hospital, many times they'll do an ECG and they'll see if you're actually having what we call ST changes. ST elevation MIs is what we're looking for in that case. So the ST segment is an ECG, and again, I'll explain that a little bit later in navigating heart disease. So just to reiterate, going to the hospital, if you're having chest pain, is very important. Don't come to the HeartFit Clinic, go there. And it's important to then look at the CK enzymes and troponins and get that ECG done to see if you're actually having a heart attack. Many times, if you're not, you could be having what we call microvascular disease, or you could have blockages that are not showing up as a heart attack. And that's where the HeartFit Clinic comes into play after that, because we have the best ways to see where your risk is in that way, but also then looking at preventative strategies to reversing the disease process. And that's the most fun part that we do at the HeartFit Clinic.
I had a double bypass 2 years ago, and was because I had collapsed from a cardiac arrest. Of course, they patched me up and told me I would never get back to the physical level that I had before my event. And I did the total cardiology program, but that was just an exercise routine. Yes, it gave me results, but it did not solve or correct or get me anywhere near the results that I really wanted. Since I've been to the HeartFit Clinic, it has restored a whole bunch of things that exercise alone could not restore.
So many people ask us about our healthcare system, and I don't really think it's a healthcare system. I think it's more of, I think we got the science of disease down really packed. I think once we have a problem, we have a good way of, the science of how to treat that disease. But I don't think we have the science of health down packed. And that's the power of what we do in our clinic is really a big science that I don't think we practice amongst healthcare professionals. And so what we focus on is lifestyle changes. We focus on having the best treatments to prevent and reverse heart disease.
They did not address the underlying issues that I personally have. And Diamond and staff here have addressed the underlying issues, and I feel that they are reversing the underlying issues.
If you provide the right environment for your body to heal, for your heart to heal, you can reverse the disease process.
This is, to me, is giving me the increased circulation and the exterior things that you just accept as old age, and those have been reversed since I've been coming here.
The fact is that the majority of people that have cardiovascular disease, heart attacks and strokes, actually have normal cholesterol. And so we have some great tests to see where your cholesterol is. It's really about looking at the particle sizes of cholesterol and the ones that can be plaque causing. So we talked about plaques happening like a pimple on your face. And if that pimple happens inside an artery, it doesn't happen from cholesterol sticking to the arterial wall. That's furthest from the truth. What happens is it builds up like a pimple inside our face inside the artery wall there, and we talked about that already. But there are differences between size of cholesterols. So when you go to your doctor's office, it's a very important first step, and they look at your cholesterol. They look at the good cholesterol, they look at the bad cholesterol, and they look at an ugly cholesterol. But what we do at the HeartFit Clinic is a little bit different. And the reason why is because the majority of people who are in the hospital with heart attacks and strokes, they actually have normal cholesterol. Normal cholesterol where they wouldn't even be treated with a cholesterol-lowering drug, and that's another story. However, many times we fail to look at the size of the particles. So let's say all these people here had the same cholesterol number, the LDL cholesterol number, which is the bad cholesterol. However, not all of it is that bad. I'll explain. This gentleman here is sitting with larger size particles, where Maria is sitting with smaller size particles. And let's talk about the danger of smaller size particles. The artery is protected by like a tennis net-like structure. They're called endothelial cells. And those endothelial cells don't allow the bigger size to go through, the tennis balls. So the tennis balls can't go through that tennis net because they're too big, and they're healthy bad cholesterol. I know that sounds funny, but there are bad cholesterols comes in those different shapes and sizes. Large ones are okay, they're healthy. It's important to have good cholesterol. Cholesterol is important for a lot of things, and I can have another conversation about that. But when we have the small ones, those are what we call more atherogenic. I'm going to explain atherogenic. Atherogenic are plaque causing. These smaller particles can go through the tennis net, through the barriers of the arterial wall, and start the atherogenic process. And so what we do at the HeartFit Clinic is look at the particle sizes in good cholesterol and bad cholesterol. And it's important to look for those atherogenic particles. And that's the particle size test that we do at the HeartFit Clinic to see where your risk is for pimples starting to build up inside the arterial wall. So that's the lipoprotein particle size test. So at the HeartFit Clinic, we like to look at the health and the function of the artery wall. And so one of the things we do, the first two arteries that come off the heart muscle are the arteries in the neck. And we like to see what's going on right there because it's easier to measure. And what we do is we do it by ultrasound. So we look at a screening test by the neck here, and we look at what the thickness of the arterial wall is, but also if there are plaques. No matter what size a plaque is, any plaque is no good. And so we screen this artery wall here and see what that risk is. So just showing on this side here, just an animation there, we're looking at this little thickness right through here. We're also looking for any small plaques that are inside the arteries of the neck. In this test, what we do is we hook you up to an ECG, We monitor your blood pressure, we monitor your heart rate, we monitor your oxygen levels, we monitor your blood sugars before and after, and we want to find a safe level for you to be exercising safely and effectively. And so we ramp you on a treadmill. If you're not able to be on a treadmill, we can get you on a different modality, a bike of some sort. But here, what we want to find out is we exercise you and ramp you up, and we try and find that exact exercise target heart rate that you can be at safely and effectively. With our treatments, we can grow new arteries and improve heart function. And all that kind of stuff is really great and unique, and more importantly, to helping patients dive into what nutrition they should be having, what they should be, how safely they should be exercising, and what things that they can do to supplements that they can take to really prevent and reverse heart disease. The majority of heart attacks and strokes actually occur with blockages that are less than 50%. So we have the best tool now to detect what your risk is of a heart attack or stroke in the next 5 years. And that's what we do at the HeartFit Clinic. We look at, see what the cause is, and more importantly, looking at some key inflammatory markers for heart disease, because that's really the problem where it happens.
I just want to say that it's inspirational to me to see people come in who are committed, first of all, to understanding what their health situation is, and then taking steps to improve their health. It brings me joy every day to see people becoming healthier, stronger, and having more energy, and knowing that we have helped to make that difference.
Really, what fuels my passion now is the changes that we see in our patients. It just brings a huge smile to my face when I see the people walking away from our clinic and with a sense of purpose now, and helping people really thrive with heart disease and prevent a heart attack or stroke.